All right, so we've got 50 minutes or so before we hear from the President. Let's speak in the meanwhile to Professor Salim Abdool Karim. He, of course, has served as the chair of the Ministerial Advisory Committee on COVID, and he is, of course, the director of Caprisa, the Centre for the AIDS Programme of Research in South Africa. And, of course, he works globally with scientists around COVID and other matters. Prof, always great to chat to you. So talk to me about tonight. From a science-led perspective, what should we be doing with our restrictions, things like the mask mandate, etc.?
Good evening, Sally. It's a great pleasure to be with you, and good evening to all of the viewers. We are at the moment in the period between waves, and we know, based on the last 2 years, that after each wave, we have a period of about 3 months which is in low transmission. The cases remain low, the deaths remain low. And during that period, we are in a pretty good position to ease our restrictions. For example, one of the restrictions that we could quite readily drop is the requirement of outdoor masks. But we must remember that indoor mask wearing becomes very important because it's in the indoor environment that the virus can spread very rapidly. So I think those are among the things I'm hoping that the President will comment on this evening.
We also know, for example, that we still have restrictions on gatherings. At the moment, 2,000 people allowed to gather outdoors. Would you suggest that that limit should be taken away for outdoor gatherings?
Yeah, so I've been a bit concerned about the potential for gatherings to spread the virus. I mean, when you just think back to our own experience, that when we were in a situation at the end of November of 2020, it just took one event, the Belito rage, to spread the beta variant from a handful of cases. Within a matter of a few days, we went to over 1,000 cases as the youngsters at that function spread out. So I think we need to have some restrictions. Most of the restrictions on outdoor gatherings can be dropped because we understand that outdoor gatherings, especially in a situation where you are in sunshine, in the air, it's not a problem at all. We could ease many of those restrictions and reduce those. However, indoor gatherings, which have the potential to do what we already saw in November 2020, some restrictions need to be maintained. Most of those would be around the number of people, but more importantly, that individuals who are entering indoor gatherings should preferably be vaccinated and should be wearing masks.
You know, I want to just chat to you about something. We played a clip of Prof. Massimo Shabela, and he said that it's unclear what government's policy is. And he said that there are basically two options. The attitude of, look, because of Omicron, we've got a milder variant that is absolutely dominant. So let the virus spread through the community because we've got high levels of immunity through vaccination and natural infections. In other words, that would mean opening everything up, as a country such as the UK has done. Or if the policy is to try and stop anyone from getting COVID, even though so many people have immunity, that I would imagine speaks to a policy that is still quite restrictive. From a science perspective, what do you think we should be doing? Which approach should we be taking?
I think, unfortunately, both those extremes are inappropriate. So the first extreme is where, let the virus run wild. There was a whole movement along those lines very early on under the banner called the Great Barrington Declaration that we should just let the virus spread. I mean, simply, that's not a good strategy, not in any pandemic. What we need is a situation that allows us to mitigate some of that risk and to minimize it, particularly with regard to the elderly. Now, the elderly, we know, will bear the brunt of the clinical illness, but it's not only about hospitalizations and deaths. So there are now several studies that show that individuals who get infected with this virus, even if they get it infected, they get the infection in a mild manner, they have a risk up to 10 to 20% of having long COVID. This condition that's associated with brain fog, they have difficulty reading. But we've also seen, even those who do not have long COVID, that they have an increased risk of cardiac outcomes a year later. So this disease is not only about the acute problem, it's about the long-term consequences. Just last week in the journal Nature, there was a paper published that showed that individuals who have had COVID-19, even if they had it mild, their brain size is smaller. The amount of gray matter they have is less. So we have to factor that into our thinking. No one should be exposed to this virus unnecessarily. We know, however, on the other extreme, we cannot stop this virus from spreading. We don't have the wherewithal to be able to do that. This is a highly infectious organism. So the goal should be to try and minimize the number of individuals infected.
From a science perspective, you mentioned vaccinations a little earlier. We haven't had an update from the President on whether he believes that vaccine mandates are still something that is required. But do you think it would make sense from a science perspective if we tie the freedom to, say, attend a big outdoor gathering of 20, 30,000 people, for example, to vaccine status? Do you think that that's something that still makes sense?
I think that's actually a critically important thing to do. You know, when we went to Paris to speak at the Pasteur Institute, everywhere you go, even if you go into a little supermarket or into a grocery store, into a shopping mall, you have to show your pass sanitaire. When you are in New York, you can't go anywhere unless you show your vaccine certificate. So that's how many of these countries raised the position where they were able to get high vaccination coverage, but importantly, they protected their indoor environments by just restricting it to vaccinated people. And that's individual choice. You choose not to go into these environments, and so you would choose not to get vaccinated. But it's really important to do that. Unfortunately, we have quite confusing signals from our government about whether there should be these vaccine mandates or not. I mean, just recently we saw new regulations from the Department of Employment and Labor, which, you know, just took us one step forward, but took us 2 steps back. There needs to be clarity, because if we're going to do this, it needs to be done with, you know, the whole effort to try and ensure that indoor environments are restricted to vaccinated people and to create a safe environment in that setting.
We have seen, I mean, you know, we've got, I think, about 42% of adult South Africans who've been vaccinated. It's much higher in the really vulnerable groups, which is great to know that the more vulnerable people are mostly protected. You mentioned the issue of individual choice. Looking back over the past 2 years, do you think that public health specialists got it wrong in not understanding the resistance to vaccines?
I think that when we have dealt with epidemics in the past, we have never been dealing with it in the midst of the infodemic that we have seen with COVID-19. This deluge of information, this deluge of misinformation and disinformation has been at unprecedented levels. And I think part of that has created confusion in the minds of individuals about where the truth lies. And that has been one of our big challenges. It's very hard to fight a situation where people are not getting a signal that's consistent, because that creates the confusion. I think at the end, what's important is that we understand, and I've seen this now, I've been involved in major international commissions that have been assessing many countries and their responses. One of the critical variables is in those societies that place a high value on every individual caring about their fellow individuals, caring about their fellow citizens, like we would under a system of Ubuntu or under a system of society where we focus not just on ourselves. So those countries have tended to do well. In countries where they have focused on me first, the individual beyond everything else, those countries have tended to do worse. Because fundamentally, you cannot fight a pandemic if everybody's going to do their own thing. We have to have common purpose, we have to have leadership, and we have to be able to move together in a direction where we care for each other.
Thank you so much for chatting to us this evening, Professor Salim Abdool Karim. Of course, he served as the chair of the Ministerial Advisory Committee on COVID-19. He is the director of Caprisa, which is the Centre for the AIDS Programme of Research in South Africa. And he's suggesting a middle road. We still need to be cautious, he would say, masks. We still need them indoors, but outdoors he would certainly suggest, from a science perspective, that we do not need them anymore. It'll be very interesting to hear what the President has to say.